start by giving a brief introduction of myself. I am Andreas Anastasiou. I am originally from Cyprus. I was educated in the United States. I spent 21 years in the US, 10 as a student, and then 11 teaching at the University of Pittsburgh and Mary Baldwin University in Virginia. I worked in some inpatient units in Veterans Affairs hospitals, treating Vietnam veterans and first Gulf War veterans. And also as a psychologist, I would see people like you and me, both in the United States and in Cyprus. And I would also see many doctors, actually, both in the United States and in Cyprus. So in this presentation, I'm going to talk to you a little bit about my experiences, also integrating psychology and medicine, because the other person that wrote this chapter is Dr. George Samouris, who's a medical doctor. And the two of us have integrated psychology and medicine in this idea of taking care of yourself, of ourselves. It's the old cliche that we say, before taking care of someone else, you have to take care of yourself. And I dare say, when we are in caring professions, actually, I don't like to think of what I do or what we do as a profession. It's more like our life's work. I think it takes a different meaning. We have greater responsibility to take care of ourselves, so that we can avoid compassion fatigue, and we can be emotionally more present with our patients, with our clients. But also, we will be able to be more present with our kids and our home life, because the two have to be integrated. You know, the idea that, I leave everything behind, I go home, and that's it. That simply is not the case. Okay, those are some of the things that we say to ourselves, but that's not really what happens. We go home, and a way to assess how good our life is, it's the idea of being happy wherever it is we're going. It's very important to get up in the morning and be happy going to work and finishing work, and it's very important to be happy going home. We need to be happy going on vacation, being happy coming home from vacation, getting back to our routine. Whenever we're not happy going somewhere, we need to look at it. Because if we are not happy on a consistent basis going somewhere, then we have crafted a life from which we want to escape. And that's not what we want to do. One of our goals, and I dare say this is a first world problem, or rather a first world privilege, is that we can craft a life from which we don't need to escape. And as a psychologist with my clients, that's one of the things we want to achieve. And I think, as I heard the previous speakers and good friends, another thought that I had as a professor teaching psychology students, okay, but also training medical students in their relationship with the patients, is that, as I always say, I can teach people how to give an empathic response. It's very hard to teach people how to exude empathy. And that's where self-reflection comes in. The two are not the same. And another thing that I feel I need to say is that the kinds of things that we will talk about today are not just things that we do with our patients. This is more like a spirit, a philosophy of life, a spirit that should be taken everywhere, in our homes, the way that we live our life. And this idea of communicating compassion is very consistent with an American theorist I like a lot, Alfred Adler, who says that the psychologically healthy person is the one who is in touch with his or her own innate need to take care of other people. The idea of social interest, that's what he calls it. And what I would like to do now is share my screen, because I do have some slides that I would like to show you. This was just an introduction and sharing my thoughts with you. And I think that I need to mention about Cyprus in parentheses. Cyprus does not have a written language. Our language is actually an amalgam of all the conquerors that conquered Cyprus throughout the years. So we do come from an oral tradition, a narrative, if you will. My grandmother was illiterate, and yet she could recite these really long poems that she had learned from. So essentially, we're a country of storytellers, and unfortunately, we're beginning to lose this. And in my presentation, I'm gonna give you the stories of some actual cases of clients and patients that we've had, hoping that we will become their voice. So let me just quickly share my screen.
So you should be able, yeah.
Yes, excellent. So let me go to the first slide now. Healthcare workers are routinely asked to satisfy emotional, physical, and many times spiritual needs of others at work and at home. And these often taxing demands, expectations, make them particularly vulnerable to developing compassion fatigue. And PTSD, depression, anxiety, as well as a whole host of other personal relationship challenges. When it comes to compassion fatigue, I need to, another thing I feel I need to mention is that we actually have gender differences, whether we like it or not. Women are much more vulnerable to develop compassion fatigue because we do live in a sexist world. And especially in this part of the world, I dare say, women are asked to have a second shift. The first shift is going to work. Second shift is coming home, and they're more likely to be responsible for the play dates of the kids, doctor visits, homework, school, much more likely than men, and also taking care of the house and the traditional, so to speak. The other thing that happens is that women are much more likely to be asked to be the emotional support of a lot of people. There is even a study suggesting that whether you're male or female, you need to have a woman in your life to buffer you from depression and anxiety. This is primarily because women are socialized to be more empathic, to be more compassionate to the other person. Okay, and I say the word socialized because I refuse to believe that us men are emotionally constipated, unsophisticated jackasses. I refuse to believe that. Okay. And one of the things that I hear from a lot of women who go through this compassion fatigue, and compassion fatigue is not necessarily burnout. Compassion fatigue is a little bit different because it comes very suddenly. And when compassion fatigue kicks in, that's when someone might be suffering. Okay, it could even be our kid, our 4 or 5-year-old kid who comes and says, "Oh, mom, dad, I've had a fight with this kid at school, or my toy broke, or please play with me." Instead of us feeling empathy and compassion, we actually feel annoyance and irritation because another person, whoever that person might be, wants an emotional part of me. Okay, then comes guilt. Okay, and one of the things that I hear from a lot of women in particular is this need to go somewhere and be by myself. I don't want to have anybody on my head anymore. I just want to go somewhere to relax, leave me alone. Okay, this is, by the way, across the board. And then comes guilt. Oh, will they be able to do this, that, and the other? And will I be a good mother? Will I be? Oh my God, am I supposed to do this? Okay, I dare say, if you're in a position of a caregiver, you should you should be taking very good care of yourself. Okay, so integration of psychology and medicine it's something that I mentioned. Okay, and we are going to focus on real cases of people like you and me. Typical recurring issues brought to psychological therapy by healthcare professionals, and these are some cases that some typical cases that I'm bringing in. The first one I called restrictive emotionality. This was a case of a 60-year-old doctor presenting with covert depression and anxiety. Covert depression is a type of depression that I would say has been more researched within the past 25 years. The type of depression that it primarily afflicts men. Women can have this as well, but this is more like a male type of depression. We don't lose functionality. We get up in the morning, brush our teeth, take a shower, hopefully, have a breakfast, we go to work. We might crack a joke here and there, but this type of depression comes out with a lot of stress, a lot of anxiety, and a lot of anger, and a lot of irritation. So if you are living with someone who has covered depression, a man who has covered depression, typically the family of that person, the way that they think is not, what can I do or not do to make him happy? Is more like, what can I do or not do so that he does not get mad? So people in his household think in those terms, and they're more likely to know how he feels and be able to predict his behavior, and they know what to do to avoid conflict, essentially. This particular case, we have this 60-year-old doctor, GP, presenting with covered depression and anxiety. What happened is that at some point, after quite a few years, he was alienated from his wife and his kids. His kids were very upset with him. When I saw him, his kids were like in their 20s. They were very upset because they felt they lived their childhood, their adolescence, and their father was not really present. Okay, he did not participate in their upbringing. The other thing that happened is that the stress that he was going through shifted his parenting style to a very authoritarian style. And there is a lot of psychological research to suggest that stress, you might be the best parent ever, but stress can shift our parenting style and make us more authoritarian in our parenting style. And the authoritarian individual, the authoritarian parent, is one who is emotionally absent, but likes to exert absolute control. He ended up being a bad listener, very controlling, and highly critical of everybody around him. The other thing that happened in this particular case is that it was his inability to convey empathy to anybody. So when he came for therapy, he was 60 years old. His wife didn't want to be with him. His kids didn't want to have anything to do with him. And he was completely lost. And he kept saying the thing that, you hear a lot of people, at least in this part of the world, say, I am working for everyone else, and look what I'm getting in return. Okay. So this was one typical case. The other typical case, I call this I need to need. A 40-year-old female physician who sought psychological support following a disproportionately strong emotional outburst toward her elementary school-aged elderly child. She was an example of someone who was suffering from compassion fatigue and anxiety, and she had a compromised ability to communicate empathy and compassion. The emotional demands from her family and work environment were too much. And she also had all these thoughts. Am I a good mom? The other thing that she did quite a bit was to beat on herself. It's like she was putting herself down all the time. And she learned how not to need and only focus on others. That was another thing that she was socialized to do. Let me take care of this person and the other person and the other person and the other person. I take care of my patients. I take care of my husband. I take care of my kids. But the self-care was nowhere to be found. She completely ignored what she needed. Okay. And I remember asking her that question. So how do you take care of yourself? What do you do? First, she put her head down. Then she looked up and started to laugh. And then she started to cry. She realized that she had crafted a life from which she needed to escape. And that had a significant impact both on her relationship with her patients, but also on her relationship with her husband and her children. I can talk much more about all these cases, but I know we are constrained by time, so I'm going to do it a bit more quickly. Case number 3, injecting life into living. 32-year-old female medical student who sought psychological services to cope with the overwhelming demands of medical school. Complained of not having enough hours in the day to carry out all her responsibilities as a student, as a wife, and a mother of a young child. The biggest issue there was that her husband was the one who was doing more of the child caring, and she felt like my husband is adjusting to me, my children are adjusting to me, and she started having a lot of sleeping problems, self-doubt, and began to question her identity. Who am I? Am I cut out for this? Should I be doing this? Okay, and this idea of self-doubt is very, very prevalent. And one of the things that we started to do was to redefine success. What does it mean for you to be successful? And this idea of defining success is a very personal thing. In trying to define our identity and what it means to be successful, we have to get everybody else out of our head. It's a very individual thing, I think, to do. Now, again, I can bring you a lot of cases, and we can talk about a lot of cases. But I gave you some typical cases. Now, self-care interventions into practice. As I mentioned before, this idea of self-care is of paramount importance. If we are in a profession to take care of other people, or when we become parents. Okay, whenever we become parents, we have a much greater responsibility to take care of ourselves and take care of our relationship, which another layer of self-care. Okay, taking care of our relationship. It's extremely important for people who do what we do to be in good relationships, to be in relationships of empathy, because we need empathy. We need to have a good listener in our life. Prioritize and invest in meaningful, healthy relationships, especially those with our family members. Good relationships can help physicians prevent burnout. I'm going to go to another study that was conducted, actually still going on. This started at Harvard University like 85 years ago. It's a longitudinal study, and now they are in their 7th or 8th supervisor of that study. And essentially what they were examining is what makes people happy throughout their life. And when they saw people in the, a lot of the participants of the initial study have died, but a lot of them are in their, 80s, some of them in their 90s. The number one thing that, of all echelons of society, also socioeconomic statuses, the one thing that they had in common as people who were happy with their lives is that we had good relationships. Number one. Okay, that's why we need to invest in our relationships. There is another theory that I like a lot by a Swedish developmental psychologist, Erik Erikson, who he's a stage theorist, and I'm not going to get too much into that, but in the last stage of life, what he says is that that's the time when we look back in our lives and we say, did I live a good life? Am I happy with the kind of life that I live? Am I happy with the relationships that I have established? And if we look back and say, you know what, I lived a good life. My life's work was good. I'm happy with that. I'm happy with my contributions to society. I'm happy with my relationships. That's when we're going to experience what he calls a sense of integrity. But if we have a lot of regrets, especially when it comes to relationships, we're going to experience a sense of despair because life has come to the end, and there is no time to go back and redo things. Very important intervention. Be mindful of how we connect with, but also how we might alienate others, and practice kenosis. Kenosis is a Greek word. I actually learned that word from one of my professors when I was a student in the United States. It's amazing that all these Greek terms I actually learned in the United States. I never knew about them when I was in Cyprus. But kenosis is a Greek word connoting the creation of a physical, psychological, professional, and spiritual space where two or more people are invited to enrich one's existential experience. People who are narcissistic don't have space for anybody else, and people who are narcissistic do not convey empathy to someone else. And it might be hard for you to believe this, but there is a lot of narcissism amongst the medical profession. And another thing that I think we need to mention is that the question, the humble question, is not, am I a narcissist or not? The more humble question is, when am I being a narcissist? acknowledging that I am a narcissist too. And it's the idea of being self-reflective, have that self-awareness, and by having that self-awareness, then I can work on it. Okay, then I can work on it. And because if I'm narcissistic, I torpedo all my relationships. We mentioned having a good listener in our life, very important. We mentioned acknowledging and expressing our needs. We need to need, and it's okay to need, but we need to acknowledge it and express it. Exercise, as simple as that might be, physical activity in the form of exercise has been shown to be effective in reducing symptoms of depression and anxiety. There was a very interesting study published by the Harvard University Medical School, and what they were investigating was non-pharmacological interventions for the treatment of depression and anxiety. And there were 4 things that came up, and it's not 1, 2, 3, 4. It's 1, 1, 1, 1. They're all important. Exercise, nutrition, good relationships. Number 4, gratitude, the spirit of gratitude. As my grandma, who was illiterate, I have a lot of funny stories with my grandma. I used to take her to church on a motorcycle when she was 90 years old. Anyway, that's for maybe a story at a bar with a drink. But you would always say, when we get up in the morning, we have to thank God for what we have, for all the good things in our lives. Remove from our schedule unnecessary sources of stress. What things can I remove from my life that I don't need to have them? Take care of our physical health. Doctors are notorious for ignoring their physical health. Okay, it's okay to see a doctor. Okay. Seek psychological support when you need it. It's okay to see a psychologist. I always say, as a psychologist, and this is my philosophy, that the people who go and see a psychologist are actually the healthiest. Okay, it's the idea that I have some challenges in my life. I am aware of those challenges, and I go somewhere because I want to work on them. Spiritual care can help healthcare professionals recognize and respond to the needs of the human spirit, including the need for meaning, purpose, and connection. The other questions that I see many times with clients is with medical professionals is this idea of redefining success. Even though what it means to be successful is a very personal topic for exploration, the following questions frequently emerge during the course of psychological therapy among healthcare professionals. Am I happy with my life? How did I get into the right field? Okay, when compassion fatigue kicks in and self-doubt kicks in, we start questioning, am I in the right field? And whenever we are in a field, whenever we do something that we really enjoy and is consistent with who we are, okay, I think David Haslam said something to that effect. Whenever we do things that are consistent with who we are, we feel integrated and it feels good. So whenever we do something that we like, we have greater of a responsibility to preserve it. So am I cut out for this? What is it like for my spouse to have me as a husband, as a wife? Very big question. What's it like for my children to have me as a father, as a mother? What is the experience of my patients of having me as their physician? What's it like for them? What would my colleagues say about me? How do I affect them? Do I have a pressing need to escape from my life? Is there any unfinished business in my life? I can go on and on and on, but this is what I would like to mention to you today, and I'm looking forward to our discussion a little bit. I think I might have taken a bit more time, but I'm only human. Thank you very much.